Fixed orthodontic appliances represent a fundamental pillar of contemporary orthodontics, as they allow the application of controlled and continuous forces that guide dental movement toward a functional and harmonious occlusion. Among the most representative systems are Edgewise, Begg, and Straight Wire, each with biomechanical particularities that correspond to different clinical philosophies. The selection of the most appropriate system depends both on the type of malocclusion and on the therapeutic criteria of the orthodontist. This section explores the historical evolution of fixed appliances and analyzes the systems most widely used today. It examines in detail their components, brackets, arch wires, bands, tubes, and ligatures, as well as their role within the orthodontic system. It also addresses the biomechanical principles that regulate their action, including variables such as arch wire cross-section, elasticity, and the point of force application. It further reviews treatment planning across its various stages: alignment, leveling, space closure, detailing, and finishing. Anchor control, essential to prevent undesirable movements, is discussed in depth, and clinical cases are analyzed to strengthen therapeutic reasoning and the decision-making process of the developing professional. Mastery of fixed appliances represents an essential competence in modern orthodontic practice. Technical and biomechanical understanding, combined with precise application, enables the clinician to manage highly complex cases safely and effectively, contributing to the development of a solid, updated, and excellence-oriented clinical profile.